From reconnecting with nature's blueprint, we now move on to another crucial dimension of health, the heart. Not just the heart as a symbol of emotion or vitality, but the heart as an organ that reflects how well our inner systems, physical, mental, and emotional, stay in sync. Our next speaker, Dr. Ashwani Garg, is a functional medicine doctor whose mission is to treat health at its root causes, not just at symptoms. With years of experience addressing complex chronic conditions, from autoimmunity to gut health, Dr. Garg brings a refreshing perspective to modern medicine. He's also the co-founder of platforms like Wellfinity, Autoimmunity Care, and Quantum Heal, and one of the driving forces behind the Indian Association of Functional Medicine, which is IAFM. Okay. In his talk today, he'll help us reimagine cardiac care and understand how to combat cardiac fatigue, one of today's most pressing yet often overlooked health challenges. Please join me in welcoming Dr. Ashwani Garg.
Thank you so much. We will come from the subtleness to the physicality. Okay. So today I think we all see in the short clips that people are dying, dropping dead just like flies. So I think heart health is one of the important topics. It's not always that bigger arteries getting clogged just at an instance. It could be autonomic dysregulation because one of the reasons we see autoimmunity, which is rising post-COVID and post-COVID injections. And also there could be metabolic dysfunction that is happening. So I will be discussing that part. Of course, water is important, light is important, basics are important. Beyond basics, so much can be done, but if we don't do basics, then we are still stuck. You can put any amount of peptides, you can put hormone replacement, things like that. But if we don't do grounding, don't get sunlight, we are still there. No problem. Yeah. See, light doesn't fail, but technology can fail. So what Mutha said is light is the key. Light is the life.
Successful event has at least one presentation like this.
So it's just light telling us, we should trust the light, not the technology. Well, just on the topic itself, what do we mean by cardiac fatigue? So there's a chest pain, not because the vessels are clogged, but still the chest pain is there. We can term it as a cardiac fatigue. So a lot of people, they even after post bypass surgeries, they still have this angina. They still has this pain when they walk and things like that. So it is not that always that we have to plumb the artery. It could be just that metabolically the muscles are weak. The mitochondria within the muscle myosite is weak. So this is a sort of a context to the topic. Yes. So the injury to the muscle could be because of the various reasons. Conventionally, we're still looking at the major macrovasculature, the coronary arteries. Of course, this is one of the leading cause, but there could be other reasons. And one of the reasons within that is acute coronary artery disease, and you have the atherosclerosis. But atherosclerosis doesn't just happen that there's more fat floating in the system and it gets stuck to the artery and we have a clogged artery. Before atherosclerosis happens, there's much more happening. So we just don't blame the fat for every coronary artery problem. It's something we have to understand. And of course, the topic today is metabolic dysfunction, microvascular and endothelial dysfunction. So arteries are okay. The coronary bigger arteries are okay. But still there's a problem, and it could be because of metabolism, it could be because of endothelial is not okay. So we'll discuss some of these things. And in research, we call it, or in medicine, we call it angina without coronary artery disease. So pain in the heart, angina doesn't always mean the artery is blocked. Okay, and there are so many people with the problem, and in literature it is saying it's 5 to 17% of people which has angina and their arteries are not blocked, but I think the numbers are much bigger. So we have to look beyond the plumbing of the artery always. After plumbing also there's pain, but there could be other reasons also, like I said. So metabolic cardiomyopathy, infarction with non-obstructive arteries, and of course the microvasculature. So when fatigue happens at the cellular level, there is a play of things. One, of course, the metabolic inflexibility, which means insulin resistance. Another one is chronic inflammation. And we need to look at the reasons what is triggering up the inflammation. Endothelial dysfunction, leaky gut. In functional medicine, one of the core subject, we treat brain, we treat heart, we treat autoimmune, we look at the gut, we look at the digestive system. And of course, the chronic stress, sympathetic overdrive, and nutrition, macro and micro. See, our body physically needs nutrition. We cannot just deny it. We have been denying. I mean, there's no doubt. We know that nobody cares about nutrition, but at least we cannot. This is the physicality of us, right? And light can transform into nutrients also if you learn that. So just we get into details of that. The metabolic inflexibility means insulin resistance. Insulin resistance means basically your mitochondria is not efficiently working. Thereby, there is a resistance of insulin. Okay, thereby sugars goes up. So in that case, the heart is not able to switch the fuel. So primarily, heart needs more fatty acids as a fuel. Now, when we lose flexibility, when we have insulin resistance, the fuel switching becomes a problem. And this is where you are doing intense exercise and your system cannot switch the fuel and you have a cardiomyopathy, you have a pain. Now, insulin resistance, like I mentioned, ATP production goes down. Okay, and when this is happening, there's more reactive oxygen species also. Thereby local cellular damage, thereby pain, not because arteries clot. Second, of course, the chronic grade inflammation. Now, your toxins in the food, toxins in the water, the air, the gut microbiome toxins, which is produced because of the bad microflora, all of that, of course, the old cells, which we are not able to replace because of low nutrition, all of that will lead to low grade inflammation. Eventually, there could be reduced contractibility. There could be loss of the cells in the heart. There could be microvascular dysfunction. Of course, metabolic injury, the mitochondria is not performing well. And of course, it can lead to more prothrombic state. Not just the bigger arteries, smaller arteries it is happening, thereby the dysfunction of the myocardium and more fibrosis. It's at a cellular level, not always, you cannot take a scope and look into it. You can do more organic acid tests to see what's happening. Again, our vessel health depends on how much nitric oxide is being produced. Now that depends on the endothelial health. If our endothelial health is damaged, then nitric oxide production is lost, then we cannot dilate. And so, of course, the other things also, which brings more stiffness to the vessels. Okay, and this can, because of resistance of insulin, inflammation, toxins, poor diet, we don't have enough nitric oxide, our vessels are constricted, there's more clotting, more inflammation, flow to the heart muscles is reduced, cells is reduced, then we have angina. And of course, functional medicine, this is our favorite subject, your leaky gut. So you lose good microbiome either after bad diet, or if we have taken a lot of antibiotics, or we're not getting enough sunlight, because sunlight is also sculpting our microbiome, or we are always under artificial lights, which grows pathogenic microbes into our system, thereby dysbiosis, and we lose healthy microbes, which will produce good stuff for us, which is not happening, and we have more toxic waste. One of the known, which is now becoming very common, is trimethylamine, which is a toxic waste to the blood vessels, and of course LPS. This toxin waste will lead to a damage to the arteries and the cells, thereby leading to more atherosclerosis, more fibrosis, and worsening the myopathy of the heart muscles. Okay, so these are some of the things well established in the literature. I'm not making it up. It's all well established in the literature, but we're still trying to plumb the major vessels. We don't look at the cellular cause. Your stress. A lot of people have an event and have a stressful event, somebody passes in the family, things like that, and then they have a heart attack. It doesn't necessarily mean that the arteries are blocked. It's just a stressful event, persistent stress. They have more epinephrine, there's more cortisol, leading to more heart rate, leading to more high vascular tone, increased demand of oxygen, which vessels are stiff, it cannot meet the demand. Thereby, again, endothelial dysfunction, mitochondrial oxidative stress, and eventually an injury to the muscle. Like I mentioned, nutrition is very, very important. Coenzyme Q10 is such an important thing. Okay, and we can test all of these things. Today, the testing is so simple, is so cheap today. We can test. This is required in the mitochondria. It supports the electron transport chain. And if it is not there, there could be a fatigue and myopathy can develop. B vitamin is such an important thing. We're typically testing B12, B1, B2, B3, B9. So important. They are the cofactors for energy production. It goes slow, mitochondria function goes slow, ATP production goes slow, and eventually we have a problem. Magnesium is such an important thing. Right? We can take magnesium-rich foods or supplements. See, at the end of the day, we have to feed ourselves what it needs. Doesn't matter where it is coming from. As long as it's a good quality, should work. And of course, I said the fuel to the mitochondria, heart muscles is your fatty acids. And you need carnitine to bring it to the mitochondria. So if if somebody has a cardiomyopathy or angina, you feed them 2 grams of carnitine, the likely that the pain will settle down. Okay, sometimes these are very, very simple things, and these are easily accessible. And of course, selenium, iron, copper, zinc, basic, you cannot deny it. The deficiency of these nutrients, decreased mitochondrial output, more oxidative stress, leading to poor cardiac efficiency, more arrhythmias and fatigue, and thereby chest pain. Sleep is so important. When we get in the sun, it's a signal to ourselves that it is time to metabolize. We start a metabolic activity. When no light falls onto us, we are under darkness. Darkness is so important to us. It's time to start repair. Now, we are constantly under blue light. Morning, we get up, we turn on the light. We go to office, we turn on the light. Just before sleep, we are turning it off. Body is confused when to metabolize, when to repair. We don't repair enough for ourselves. Following the light cycle is the circadian biology. Sun comes up, we go under sun. Sun goes down, we go under darkness. Now, we don't get enough darkness, we don't repair. Of course, poor cells, poor quality mitochondria, and it can affect your heart health. These are basics. This is nothing, rocket science that I'm saying. Just a thing on the arteries. Everybody's saying, oh, your LDL has gone up, your triglycerides has gone up, or you have to be on statins, and let me make your liver not produce enough LDL and triglycerides. Our biology is not so stupid that today we have understood and we tell them, no, I will not let you make this LDL and all that. These are inflammatory markers. Your body is responding to the toxins or the situations in the body. Triglyceride could fuel your immune system. Okay, so if there is LDL high, if there is triglyceride high, doesn't mean it is a problem. It's a problem solver. Toxins are going up, let's say endotoxins are going up. To fight that, liver is producing more LDL. Not that LDL is a problem by itself. And just because one marker is high, it's like India-Pakistan border, there's a problem, and we're sending army, and we're taking a picture of the Indian army, and say, oh, this is a problem. The fight at the border is the problem. We have to go fight it. Okay, so arteries just does not get clogged because there is more fat into the system. Because there's inflammation, there's some damage happening there. Because of that, liver makes more of these elements to go protect there, to keep us going. Okay, so very, very fundamental thing, but sometimes we have overlooked the fundamentals. Well, solution is, this Mugdha has already talked about. You get more sunlight and you get more darkness. Okay, this allows the repair in the body. It's a nature-built phenomena. Okay. Of course, nutrition, this non-physicality and physicality. Physicality needs nutrition. You need good fats, you need good proteins, you get macro and micro. Again, We don't have to supplement without knowing it. We can test all of it and then feed what is required. This is precision nutrition. And specifically for the mitochondria, you can use CoQ10, carnitine, lipoic acid, B3, PPQ, magnesium, thiamine. This is some key things we typically do into our practice. Even somebody's ejection fraction is poor, angina is happening. We do that and we help them. And we can prevent the problem also, of course. For the specifically vascular health and endothelial repair, we can use more B vitamins, more beetroot juice, and of course, arginine and citrulline to dilate the vessels by making more nitric oxide. Well, this is something I do in my practice. Now, large arteries, of course, they could be a problem, but smaller arteries are more important. And systemic enzymes can be very, very potent in that. We take systemic proteolytic enzymes. It helps to break down the biofilms. It helps to break down the immune complexes we make over a period of time. And it helps to reduce our inflammation. And it can help clean the smaller microvasculature. And if the bigger arteries are, because of inflammation, there's a calcification happening, we reduce the inflammation, we make the markers better, and we can do chelation to reduce the calcification, thereby potential to open up the arteries. So, well, I think I'm right on time, and you can ask me questions. Sir.
What about supplements like AKG rather than CoQ10? Can we jump ahead and have directly AKG or maybe ATP itself?
Like for acute situations, ATP may help, yes, but then basics has to be done. Fundamental has to be done. We can tweak the biology to some extent, but
between CoQ10 and AKG.
No, if I have to choose, I'll go the basic. Sir.
Yeah, hi, wonderful talk. You said that angina not necessarily implies a blocked artery.
Yes.
The converse is also true, right? You're having a lot of people with maybe more than 90% blockages who have no symptoms at all. That was one question. The second question, sleep, all the things, supplementation. What about zone 2 walking or just collateral development? As the artery blocks, promote micro artery blocks.
Yeah, absolutely, sir. Exercise is good, always good. I mean, this is a limited topic, I have to cover it up, but yes, absolutely. So now 90% blockage doesn't mean that is impacting the myocardium always. Right? There could be people absolutely healthy and they could have a 90% blockage, doesn't mean always a problem. It just sometimes we have to look at this system whether it's actually getting hypermetabolic.
One or two more quick questions. Nattokinase, did you mention that as an
systemic enzyme? Yes.
DTA, why is it still frowned upon by mainstream practice? We can discuss that later.
Well,
that's like a proven method that is.
Well, sir, it's not frowned. Let's say homeopathy, such a beautiful science, but from a conventional medicine, we have not read it. We have not studied it. Somebody has told it is placebo. I believe that I started seeing the same thing. Same applies to chelation. People have not even read it. People have not even tried it. They have not seen any problem with that. But just because somebody has said, they are repeating the same thing. So I am doing in so many cases and we are seeing good results. No problems so far. And Dr. CBA is one of the leading doctor in India, has been doing for decades.
Can I add something?
Yes, please, sir.
There's something which is often overlooked. That is the iron. We are talking about all this. I think iron is highly overlooked. Our different labs have different parameters, like hemoglobin, 14 to 16. Like hemoglobin 14 to 16. Most of us accept it if it is 12 or 13. Simply increasing it from 13 to 14 or from 13 to 16 can increase your oxygen carrying capacity by 20 to 30%. So I think that is something which we take it for granted. 12 hai, theek hai. I think that is something which we need to look into.
Yeah, yes.
Hello. Yeah, so we have learned that even by exercise, we get like oxidative stress more inside the body. So what's that one natural food that one should take every day as an antioxidant? Every day
Grounding.
when you wake up.
Grounding.
Grounding.
You get electrons. Electrons are antioxidant.
So, but if I have to take it through mouth, what would be that one thing? If not grounding.
Well, so many foods. I mean, I'm not a food expert, but I think Mudha can do a better answer than me. Well, sure, but I mean, the best food, berries, blueberries.
Indian product maybe. Thank you.
Soda for cardiovascular health.
Which one, sir?
Soda.
I haven't tried, sir. Most of the things I'm saying I have tried, I'm doing it, okay. I will refrain which I don't know or I haven't tried. I mean, a lot of things are there, but I don't read so much, so I'm just, whatever I see in my practice, I'm saying it.
I think as far as grounding is said, that is something which really needs to be looked into. You take an antioxidant, you do not know the quality control most of the time. You do not know when it goes in, what it will do. And grounding means it is basically to do with electrons. Electrons move at the speed of light. Once you touch the ground, there's immediate antioxidant effect. So I think there's another part which is overlooked. The last few years, now I'm walking barefoot at home whenever possible. So to get instantaneous, sure antioxidant effect, I think walking is the best. Although I do not have any studies to prove it, but I think that is the best thing and something which is absolutely free. So I think with my experience, I think that is the best antioxidant at zero cost. I mean, we should be moving in a country like India, where poverty is the #1 disease. We should be looking into things which are cheap or free, near nature. Thank you.
Excuse me. Hello. Excuse me. I would like to add something. As we're talking about cheap options and which is free for all, I think even breath work, it will reduce the oxidative stress at the blood level itself. So no more free radicals because you are using your oxygen very efficiently in your body. So breath work also really helps in that one. Yeah, thank you.
Thank you, Dr. Ashwini. That was such an insightful session. You helped us see the heart not just as a pump, but as a mirror of how well the entire system flows.